Is the cost of healthcare preventing you from retirement?
It might feel like a roadblock, but the more you know, the more prepared you can be.
What to expect and how to develop a plan to pay for it right now on Retiring Today.
Welcome to Retiring Today. We're talking about the cost of healthcare. I'm here with Loren Merkle and Anna Marie Morrow. Anna Marie Morrow is the Director of Healthcare here at Merkle Retirement Planning, and Loren is a certified financial planner, a certified financial fiduciary, and a retirement income certified professional. What you guys do each day, you sit down with families, you look at retirement, you talk about their retirement vision, but real quick, Loren, it has to get to this healthcare piece because it's on the mind of pre-retirees and retirees.
It is, which is a little bit ironic because healthcare costs used to be one of those forgotten costs or overlooked costs, but over the last 6-7 years, because of the increased cost of healthcare to pre-retirees or even retirees who are retired prior to the age of 65, most people are asking about this healthcare cost and how they're going to be able to afford it over the course of their retirement.
Yeah, and Anna Marie, we watch the different studies. Fidelity is one of those companies that quantifies this stuff. And each year, the expected cost of healthcare, it doesn't typically go down, it goes up.
It goes up, that's right. And so that's where we get together and we can talk about, we talk about that bad news of how healthcare does increase every year, but then there's good news to talk about as well. When we're able to get together and start that planning piece before they get to retirement, even if they're already in retirement, there are strategies that we can implement and talk through to possibly help mitigate that cost.
And that's what I love about Anna Marie. She goes right to the positive.
That's exactly what I was thinking.
Because that is her nature.
Let's get off the bad news.
Right.
It's all good news.
She wants to sit down with people. She wants to sit down with you and say, hey, here's how we're going to pay for this piece. Here's what we're going to do. We're going to elect Medicare here, and we're going to use this Advantage plan. But I'm going to go back just a little bit to the bad news because it's a big number, Loren.
Is that why you come to me?
Yeah, you're just a little less positive now.
Yes.
It's over $300,000 people can expect to pay right now if you're 65 or over, and that doesn't include long-term care.
Yeah, do you remember sitting around a table not too long ago and we were talking about how the total cost of health care, not including long-term care, was going to be $285,000, and now it's about $312,000, which is expected. And this is part of our job is to communicate some of the things you may not be thinking about. You don't know what you don't know. And when you look at $312,000, you're thinking, how am I ever going to be able to afford that? I mean, if you have $1 million portfolio, which is a really healthy portfolio, a lot of people would love to have $1 million. And then you think, take out the taxes that you're going to owe on that portfolio, and then think about how are you going to be able to afford potentially $300,000+, not including any long-term care costs. It's a big number that you have to overcome, and that's why we have to make healthcare a part of the overall retirement plan. If we just ignore it, we're going to have to pay for it somehow. So what kind of strategies can we implement to really make sure that you can get the healthcare coverage that you deserve and you can afford it at the same time, and your retirement lifestyle doesn't suffer?
Yeah, and let's talk real quick about the overall retirement plan, because you said it best, you don't know what you don't know. So healthcare, one of those things maybe people weren't talking about, they definitely are now. There's more pieces to the retirement puzzle that you help people put together.
And one of the most fun pieces of the retirement plan, your retirement plan, is the lifestyle piece. The lifestyle part of the plan is all the fun stuff that you've been dreaming about for all these years. Once you finally get to retire and you have this free time, what are you going to do with that free time? Are you going to travel? Are you going to winter in Florida? Are you going to chase a grandkid? Right, that's all the fun stuff. And then the other 5 components are how you pay for your lifestyle plan. And of course, you're thinking right away, when you retire, you're not going to receive your W-2 income anymore. So where's that income going to come from? You might have a pension plan. There's a lot of options with the pension plan. You have up to 81 different options when it comes to your Social Security election. And then you have this finite bucket of money, these investments, the money that you've been stockpiling away for the last 40 years. How do you take income out of those buckets of your investments? And then of course, the healthcare piece, which we're going to talk about here today, the legacy piece and the investment piece, and of course, the tax piece of the overall plan.
So we're focusing on healthcare today, but you can go to YouTube, search Merkle Retirement Planning. We've been calling this our retirement series, our Merkle Retirement Planning series, and we've been going over all of those other components that Loren just talked about. Okay, let's go back to healthcare. So the good news is, I know this is what you like to talk about. You can plan for it. That's great, right? So you hear 312,000, big number. You can plan for it. Also, there's some things you can do with your income, some strategies there that we'll talk about when it comes to Medicare. But what I think I want to do right now is talk about the things that contribute to this 312,000, because I still think if I'm hearing that number, I'm like, whoa, wait a minute, Molly, how can it be that high? Well, we're going to look at the 6 things that contribute and then the strategies to help pay for them. So the first one, guys, is pretty obvious, your health status. Obviously, you guys have seen it, the healthier you are, the less you're going to pay for health care.
Yeah, the healthier you are, the less you're going to pay, because you have things like deductibles and you have co-pays, and the more you visit the doctor or the hospital, the more you're going to have to contribute to those bills. But also medications. And Anna Marie, this is something that you talk with our families about all the time, even once they elect Medicare, is what type of medications are you taking? Because that's it could potentially increase your premiums, determine the type of plan that you have, and then out of pocket for those medications also.
Oh, absolutely. When it comes to medications, that's typically the driver in Medicare of which option, which plan you're going to go with, because each plan covers different medications. They have different formulary setups. So you're right, different premiums, escalated costs, different tiers on a drug card. It all gets pretty convoluted, and so that's where we come in and we can help streamline that information. But then also, as we're talking about health status in regards to what you're going to pay, a question I still get these days is about pre-existing conditions. And just to make it clear for everybody, that is no longer the case before you're Medicare eligible. They cannot ask Medicare or health-related questions if you've had any pre-existing conditions.
Go ahead.
But when it comes to Medicare, that can come into play, but just if you are retiring earlier before the age of 65, pre-existing conditions is no longer an issue.
Yeah, that's what I was going to say, which can lead to confusion, because once you get to Medicare age, now pre-existing conditions could impact either what you switch to from a coverage standpoint after a few years being on Medicare, or what you actually elect at 65 when you go on Medicare.
Yeah, that's right. That's right. So yeah, I get this question all the time. So that's good to just get it out there. No pre-existing conditions before the age of 65.
Yeah, that's
But the costs, like what Loren said, is there are high deductibles, there's out-of-pocket maximums. So if you do have a condition, there's a lot of options on the marketplace on healthcare.gov that can guide you to help lessen that cost if you're finding lower out-of-pocket maxes. If you're on a high deductible health plan, which is HSA qualified, where you can make contributions, that can also help lower the costs. So there's a lot of strategy that can come into play with helping in that area.
Yeah, and that kind of leads to the next factor. So factor number 1 was your health status. Factor number 2 is your age. COBRA is, let's just explain it for people, you go on your employer-sponsored plan if you decide to retire before you're Medicare eligible.
That's right. So COBRA is just a continuation of the employer plan you're already on, but you're taking over the payments that your employer was providing you. And you do have that option for up to 18 months. So what we like to do is we do that cost analysis. Is it more cost effective for you to stay on that employer plan, that COBRA plan, or does it make sense to move you to the marketplace?
Yeah, and COBRA is something that we don't want to ignore as a part of the overall healthcare plan, because it wasn't that long ago people would just not, whenever we said COBRA, they would just ignore it because it was so expensive compared to different alternative options, where now it can be a really good idea from a cost standpoint as well as a coverage standpoint for somebody who is pre-Medicare age. So it is something that we want to look at. If COBRA is a part of your evaluation, it's very simple to see what that cost is going to be. All you have to do is go to your human resources department, ask them what the COBRA cost would be, because they have that information, and then you have that cost. You already know what the coverage is because it's the coverage that you're on when you're working for your employer, and then we can use that information to compare it to alternative healthcare options, and then we have all the information at our disposal to help you make the best decisions you can.
Okay, so let's say I'm getting ready to retire before 65 and I have to go to the open market. Anna Marie, you recently, this is something you did with a couple that just shows you how the open market can just be really kind of crazy to navigate.
That's right. The number one piece of feedback I have when I'm sitting down with someone who their COBRA is expiring, they've been on it for 18 months, or they just want to look at the marketplace. The number one thing I hear is, oh, my neighbor is on this plan and this is how much she's paying, so I really want to get on this plan. So we did this. We sat down and we went to healthcare.gov and we showed them what the marketplace is based off of and how that influences what they're going to pay. So first off, we enter in their zip code, okay? Shout out to all the Iowans out there. Marion County came up as it was their county they were in, because under the zip code there are a number of different counties. It's based off of age, gender, household members, and then what they are claiming for income or can see what their income will be for that calendar year. It's based off of that calendar year income. So then it shows us what type of subsidy, what type of savings we are going to have with that information put in. They're going to have a savings of $896 that they can take off of their premium. So with this information, it was pulling up the bronze plans, the lower metallic tiered plans. They weren't going to have a premium to pay. So then, a couple weeks later, I meet with someone else who literally lives across the street. And they're like, okay, they told me about this plan. This is what they're paying, $0. So we put in the information. All we did was switch the county to Mahaska. It's literally across the street from where they live. Different county, same income. Look at the difference in savings.
Wow.
So that's really a piece to take with you when you start to planning. Listen to your neighbors, get good feedback, but don't expect that that is going to be your end-all, be-all. Be prepared to look at what other options you have that can help lower that cost. And don't think we also didn't talk about moving at one point just across the street to have a savings.
Maybe just build a little something. And let's make sure people understood, because the number difference was $896 on the first one, and then it was $1,231, or otherwise known as $1,231. So a significant difference in the monthly savings.
That's right. One family is going to have possibly a $0 income, where the other might have to pay a couple hundred, depending on what plan they want.
Yeah, and it's all based on the county, and this just lends to remind us the importance for customization on the healthcare side of it. Just like the income plan, the tax plan, and Social Security plan, all that needs to be customized. The healthcare plan also has to be customized to your individual circumstance.
We've only been chatting for about 10 minutes, and customization is a word that we've said a lot. Well, that's because your retirement plan is custom to you. Here's a great opportunity to talk directly with a retirement planner, or you can talk directly with Anna Marie Morrow. Go to merkleretire.com. You can schedule a 15-minute complimentary retirement checkup call today. We've got a lot more to talk about, though, when it comes to the cost of healthcare and a plan to pay for it when Retiring Today continues.
Biking, boating, relaxation? What's your retirement vision? Learn how to take the money you've worked so hard to save and turn it into the retirement of your dreams during our Journey to Retirement workshop. Like getting ready for a trip, getting to and through retirement takes a roadmap. This workshop is the first step to planning your 20 or 30-year vacation. Go to retirewithmerkle.com to register for our Journey to Retirement workshop this week.
Anytime I have even the smallest question about my accounts or what effect the latest tax law might have on my situation, the Merkle Retirement Planning Team is always there and quick to help. I'm so glad they treat you like family. I'm so happy to have such an excellent team working for my future and ensuring I do the best to achieve my financial goals.
Merkle Retirement Planning. Your retirement starts here.
Welcome back to Retiring Today. We're talking about the cost of healthcare and how to form a strategy to pay for it in retirement. I'm here with Loren Merkle and Anna Marie Morrow. So the things that contribute to the cost of healthcare, of course, Anna Marie, the plan you choose, because like a lot of these decisions you make in retirement, there are a wide range of plans and choices and a wide range of prices.
Yeah, and people watching know that. There is so much information that you are receiving, whether it's in your mailbox or phone calls or people coming to your door. It's hard, like which route do I go? There is so much information out there. So this is where we can get together and streamline the information to how it suits your needs. And really the two big ones out there to choose from as far as your medical supplement go is, do I go traditional, which are all the letters, F, G, K, N, Or do I go the Advantage plan route? Under both plans, you are entitled to the same care. It's just very different in how you pay for it. And there are some guideline rules as well as far as health questions and pre-existing conditions. This is where we get into that, but that's the information that you really want to cut through to see what you are comfortable with.
And that's part of the real value that you can bring to the table in those consultations is you'll walk them through what if you choose the traditional plan, the alphabet soup of Medicare, what if you choose the Advantage plan, and what are some of the considerations that you should be thinking about if you go this route and then you want to change your mind a year or two down the road, because there can be some roadblocks with trying to come back to a plan if you change down the road.
That's right, because every year we have annual enrollment, which is from October 15th to December 7th, and that's where you can make those changes. And so that is a great point to bring up, because let's say you start off on an Advantage plan, right? You have that possibly a 0 monthly premium or a very low premium, and you're just paying co-pays. But then as the years go on, you kind of like that security of the traditional plan where you know exactly what you're going to pay every month in premium and you'll have lower cost on the back end. Well, this is where you can make that change. Now the fine print is, let's say you start off on the Advantage plan, a few years later you want that security on plan G. In order to make that switch, you have to be able to answer health questions. And you could either be denied coverage or pay a higher standard premium as opposed to a preferred premium.
Another big factor that can contribute to what you pay for healthcare in retirement is where you live. Not only does it contribute to what you pay, it contributes to your options, and you've got a great example.
Exactly. Again, location, 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 just like real estate, right? So this is an example of what options you have within Polk County. So again, shout out to all the Iowans watching. This is Des Moines, surrounding metros. Polk County, these are Advantage plans available to you. Now when it comes to traditional plans, Plan G, Plan F, they're the same in Iowa as they are in California and Florida. It stays the same. But Advantage plans have different benefits, you'll have different co-pays, you could have different premiums, different out-of-pocket max, all very varying in degree. So in Polk County, this is the number of options you have to choose from, right? There's a filtering process that you can go through. What kind of benefits would you like? How are your medications covered? A lot of things to go through. And again, one of the main questions I get is, oh, I want that Advantage plan that my brother-in-law is on in northwestern Iowa, right? Well, it depends on county. So then we pulled a different county within the state of Iowa, Davis County. Look at the number of options and how it shrunk significantly. So your brother-in-law's plan in northwestern Iowa will possibly not even be available to you if you are in a different county. And then finally, you may be living in a county where there are no Advantage plans available, and you would need to be looking at the traditional route. So again, location, location, location. Find out what is available to you and what your options are.
And in case you're like me, Taylor County, one of the sparsely populated counties in Iowa, down on the Missouri border, Bedford is the county seat. So I counted it. Polk County, you got 23 options. Davis County, I think you have 7. Taylor, you have 0. So what do you do if you're in Taylor? You have to go to the other option.
Yep, you're probably going to want to look at the traditional plan, possibly point of service. It just kind of depends on what else is available. But as far as the Advantage plan goes, you're going to have to look elsewhere.
Okay, another one of the factors that contribute to what you pay for healthcare in retirement is your income. You have this conversation, Anne-Marie, with people all the time, because this is where you work with the retirement planners, Loren and the team. You can use some strategery, I guess, with this portion of it.
That's right. When you're thinking about healthcare and Medicare, you're not really in the mindset of, oh, I need to look at my tax planning, investment planning, and income planning. Well, actually, you do. It's a great idea to get that started, because once you elect Medicare, they do a 2-year look back on what your income is. And if you were in those higher incoming earning years, well, that's just another form of way that they can tax you once you elect Medicare. So they do notify you if you do have that higher income, and so then you do have options because you are you had a life-changing event occur where you retired, and then we can get together and file appeals, and we can look at other ways to save.
Yeah, when it comes to healthcare and income, you would think the correlation would be, I want my income as high as I can be to help me afford the expensive premiums of healthcare, but actually can end up hurting you. Just in the Medicare Part B, could be anywhere between $183 a month upwards to almost $600 a month, and it's all based on your income and it's not in that year, it goes 2 years back.
That's right. We've had people sit down with us and they knew exactly what they were going to pay for Medicare. $170 a month. We're prepared for that. But then as we talk through what their income has looked like, what their investment strategies have been, they're both going to be owing over $580 a month. And then the question is, well, can we even afford to retire? So then we move on to what their options are when they do get notified of that higher premium.
Yeah, that's part of the benefit of doing the planning, is to minimize the surprises. Minimize the surprises of you should have done this, looking back 5 years forward, you should have done this. This is the premium you're going to have to pay for this decision that you made. And minimizing the surprises just helps you make better decisions and make those decisions as you're making them with more confidence.
I also think it is a great case for talking to a retirement planner 5 to 10 years before you retire, because again, we know a lot of people aren't waiting till 65 to retire. They're retiring at 63. So maybe you retire at 63, you can work in some strategies that you use some other money that's not taxable for those first couple of years. It takes that Medicare premium down. That's the kind of thing, though, you can't just decide overnight. It's got to take kind of a long-term look.
Yeah, and that's why when we construct the plans, we look at a couple years back, but we also look at what's going on right now in your life from a tax standpoint, income standpoint, healthcare standpoint, legacy, investments, thinking about the market as well, but also what is going to be taking place next year, in 2 years down the road, and even 5 to 10 years down the road, because all of that information does help us make the decisions that we have to amongst each one of those components of your retirement plan to help put all of this together, smooth out the roadblocks, and make the decision points much easier.
We've got a great opportunity to learn all about those aspects of retirement. We'll tell you about that in just a second. But first, it's time to talk about our Ask the Advisor question. Take a look at your screen right now. If you have a question that you would like to see us answer here on the show, the information on how you could submit that question is on your screen. So here is our Ask the Advisor question. I'm 66 and retired, and I'm on my wife's employer health plan. When she retires, can I go on COBRA? We'll answer that question and more when Retiring Today continues.
The Merkle Retirement Planning Team provides personable and professional expertise unrivaled in this area. They include us in every step of the planning process. The peace of mind provided to us by the Merkle team allows us to fully enjoy this special time of our lives. Instead of feeling snakebit, we feel confident that with the Merkle Retirement Planning Team at our sides, we can navigate any challenge that comes our way.
Merkle Retirement Planning. Your retirement starts here.
Biking, boating, relaxation? What's your retirement vision? Learn how to take the money you've worked so hard to save and turn it into the retirement of your dreams during our Journey to Retirement workshop. Like getting ready for a trip, getting to and through retirement takes a roadmap. This workshop is the first step to planning your 20 or 30-year vacation. Go to retirewithmerkle.com to register for our Journey to Retirement workshop this week.
Welcome back to Retiring Today. Here's another look at our Ask the Advisor question. I'm 66 and retired, and I'm on my wife's employer-sponsored healthcare plan. When she retires, can I go on COBRA? Anna Marie Morrow, yes or no?
No.
It's okay to say no. This goes back to the very beginning. She's so positive. She hates saying no.
No is a negative word.
I know,
Can't say
it is. And we actually get that question a lot because a lot of times their employer plan that they're on is a great plan. And so they don't want to lose that benefit. So yeah, a question all the time is, well, can I go on COBRA for 18 months, even though I'm 66, over the age of 65, and then elect Medicare? And unfortunately not. Once you're Medicare eligible, COBRA is no longer qualified insurance. You do need to elect Medicare at that point.
And if for some reason you were keeping track at home, I did promise 6 things that contribute to that $312,000. And another one of them, of course, is what does your employer subsidize? Some people do get a shock, when they go from a really nice healthcare plan and then they go to the open market. It can be surprising.
Oh, absolutely. And that's the benefit of putting together that cost analysis, because a lot of times COBRA can be saving you a lot of money. Otherwise, the marketplace could be the best option. And right now, we do have the American Rescue Plan Act in place, which is providing a great subsidy to families to where it could be the better option. But the fine print on that is it's set to expire at the end of this year. So we don't know what those subsidies are going to look like come next year. So it could be that COBRA, if you're not electing Medicare this year, that could be a great option just to see what we can anticipate in years to come.
Yeah, one of the consistencies within all of the different components is everything is constantly changing, right? Nothing seems to stay the same, which is why we have to continuously evaluate and then update the plan as we go each and every year.
We've done a good job, I think, talking about the costs. You've given some great tidbits, too, on things to look at, things to consider. You don't know what you don't know. But still, I want like the easy answer here, Loren. How do I pay for it all? How am I going to retire? Let's say I'm not even 65 yet. I'm 63, and I'm looking at this number and going, it's only going to go up, Loren. How do I do it?
Yeah, the plan tells it all. So that's part of building out that plan is here's where the income's going to come from for the lifestyle piece of your retirement, right? That's all the fun stuff. Here's where your income's going to come from to pay for healthcare pre-retirement. Also post-retirement, what do you do from a Medicare standpoint, Medicare traditional, Medicare Advantage? What are you going to do from a tax planning standpoint? Because one of your biggest costs in retirement, as big as that healthcare cost is for most people, your biggest cost is going to be taxes. So how do you pay for the tax bill, the retirement tax bill that you have? All of that is outlined in your plan in detail, so you have the answers to these questions.
Okay, so let's say I'm interested in taking the first steps to build a retirement plan. I'm getting serious about it. I'm 5 to 10 years out from retirement, or maybe even in retirement. What's the next thing I should do? Yeah,
there's two really good ways. One is you can take advantage of the complimentary 15-minute retirement checkup phone call, where you have a really good conversation that's customized to you and your situation with a retirement planner to work through all of the questions and maybe even some things that you haven't thought about yet to bring those to light based on your circumstance as well. The other one is our Journey to Retirement workshop, where we have a specific couple. They have very specific goals that they're trying to accomplish in retirement. So we walk you through their eyes of different planning strategies they can incorporate to help them accomplish these goals. And we talk about each one of those components. We even talk about their lifestyle and things that they're trying to accomplish, and then all the financial components behind it. And you can take away some strategies from that Journey to Retirement workshop almost immediately to help you on what you're trying to accomplish your retirement vision.
And Anna Marie, briefly, you've been doing some of these 15-minute retirement checkup calls. What's a common question you get, and what kind of conversations are you having?
Do I need to elect Medicare? That's the number one question. I'm turning 65, but I'm continuing to work. Do I have to elect Medicare? And that's where we can talk through things to think about, things to consider. Do you need to elect just Part A or hold off? That's when we can really streamline that information for you.
Okay, so 2 things to remember. There's a Journey to Retirement workshop. The information is on your screen. You can sign up, or you can schedule a 15-minute retirement checkup call. Keep scrolling down. You'll see Anna Marie Morrow's smiling face there. You can schedule a call with her or one of the retirement planners to talk about anything that's on your mind when it comes to retirement, but we'll keep talking about it on this show. It's Retiring Today, and we thank you for watching.
Biking, boating, relaxation? What's your retirement vision? Learn how to take the money you've worked so hard to save and turn it into the retirement of your dreams during our Journey to Retirement workshop. Like getting ready for a trip, getting to and through retirement takes a roadmap. This workshop is the first step to planning your 20 or 30-year vacation. Go to retirewithmerkle.com to register for our Journey to Retirement workshop this week.